Iodine-131. What type of radiation does iodine-131 produce? Gamma rays and beta radiation are the two types of radiation iodine-131 emits. Gamma radiation is known to travel far distances, hence why it is used in iodine-131. Gamma rays can transport themselves out of an occupant's body to several meters away, where beta particles can only go a few millimeters. In contrast to that, the radiation that will selectively destroy most of the overactive cells is the beta particles. Gamma radiation generally plays a minor contribution 3 days after the dose of iodine-131 is taken. How is iodine-131 used in medicine? Iodine-131 is used in nuclear medicine to treat people with thyroid cancer and also to study the functioning of the thyroid gland. It is used both diagnostically and therapeutically. Diagnostically means iodine-131 is used to classify a specific intersection or characteristic, and the therapeutically means it is the treatment of particular disease or disorder. Iodine-131 has a particularly short half-life of only 8.02 days, which creates extreme radioactivity. As it has such a high rate in radioactivity, this makes the substance toxic, and it can only be taken in small doses. If being used in a diagnostic circumstance, a small amount of radioactive atoms are implanted into the patient's bloodstream so they can be examined correctly. The atoms then participate with the mucus and they gradually turn into thyroid glands. Thus, if the iodine-131 is being used for therapeutic purposes, it is injected into the bloodstream and same way, but with a much stronger dose. What are the benefits of iodine-131? If just undertaking therapy, there is no side after effects because the dose is low. If using iodine-131 for an overactive thyroid, it should make the thyroid function normally again. As the thyroid controls the metabolism, it returns the patient to a normal way of life. If using iodine-131 therapy for cancer, it should diminish of an deathly cancerous thyroid tissue completely, then having the cancerous thyroid tissue removed. What are some problems associated with using iodine-131? If undertaking therapy and then removal of thyroid side effects may include dry mouth, pain in salivary glands, and nausea. It takes a few months to know if the treatment has worked as required. The dose given for thyroid treatment is based on the patient's weight and height. However, it is still an estimate, and if the dose given is too high, your thyroid will underfunction. Vice versa, the dose may not be enough, and more iodine-131 treatments may need to take place. If treatment is for a cancer growth in the thyroid gland, there is a chance of a growth returning somewhere else in the body, and more iodine-131 treatment will need to be taken. How do the benefits of using iodine-131 outweigh the problems associated? Despite the problems associated with iodine-131, there are ways to overcome them to minimize the side effects such as a dry mouth and the pain in salivary glands. Sucking on lemon lollies helps fuel saliva and reduces the pain. Nausea is maintained with anti-nausea tablets. Though it is an estimate on how much iodine-131 to prescribe a patient, is usually rare for there to be a high or low dosage. If the dosage is too high, medication is given to keep the thyroid in order and the treatment will still take its course. On the contrary, if the dosage is too low, more iodine-131 is given and the treatment will still destroy any cancerous tissues or sustain the overactive thyroid. Therefore, regardless